Hello, and welcome to the webinar on the 2020-2022 State Health Improvement Plan. The Ohio Department of Health and the Health Policy Institute of Ohio are very pleased to share information about the plan with you today. My name is Laura Rooney. I am the Health Improvement Planner for the Ohio Department of Health within the Office of Performance and Innovation. My role is to support the development and implementation of the plan and subsequent resources for collaboration, innovation, implementation, and evaluation. The 2020-2022 State Health Improvement Plan is really a roadmap to address the many challenges identified within the 2019 State Health Assessment. Given the complexity of Ohio's health challenges, the SHIP calls for a cross-sector partnership and alignment to meet a manageable set of measurable goals. The State Health Assessment, combined with the State Health Improvement Plan, are really tools to help strengthen state and local efforts to improve the health and well-being and economic vitality of the state. The SHIP takes a comprehensive approach to achieving equity and addressing the many factors that shape our health. Together, it is the vision that Ohio will become a model for health and well-being and economic vitality. The SHIP development was facilitated by the Health Policy Institute of Ohio under contract with the Ohio Department of Health. The process allowed for feedback from hundreds of Ohioans throughout the development process. Multiple state and local agencies and diverse partners provided expertise, guidance, feedback, and support. And on this side, you can see the many state-level partners that helped participate in. And this side shows representation of local level partners that also were a part of the development process. Representatives at the state and local level also include multiple systems and representatives from rural, Appalachian, suburban, and urban communities, as well as diverse racial and ethnic populations and other individuals and groups experiencing health disparities, such as those with behavioral and developmental disabilities. Alicia Nelson, who's the Director of Recovery Ohio, she has been appointed by the governor's office to help be a liaison between us and the governor and his team as we move forward with the SHIP. And she also has provided a quote for us that the State Health Improvement Plan provides a pathway for collaboration at the state and local level for understanding that we are all serving the same families. By coordinating efforts, we can improve outcomes and the overall health and wellness of all Ohioans. We understand and recognize there are sectors of the community that have unique disparities which increase their vulnerability. Understanding their specific needs will increase our ability to support and improve health equity for all. So we thank Alicia Nelson, and I also want to thank all of the SHIP partners who were a part of this process. There was really an iterative process that took place using a steering committee comprised of state agency directors and representatives, an advisory committee comprised of state and local agencies, organizations, and multiple topic-specific work teams, as you see displayed in this graphic. So for today's webinar, there will be an overview of the SHIP materials and concepts. We will describe the basic guidance for local health departments and hospitals, and really what you can expect in the coming months and time ahead. So at this time, I would like to introduce Amy Bush-Stevens, Vice President of Health Policy Institute of Ohio. Amy and her colleagues at HPIO have done a great job in supporting the development of the SHIP, the SHAW, and the accompanying tools. So thank you, Amy, and I turn it over to you.
Thank you, Laura. We are very excited to be working with the Department of Health and all of you on the State Health Improvement Plan and are really excited to be sharing it with you today. I am going to start by taking a look at the different SHIP materials. Hopefully you're already familiar with the 2019 State Health Assessment. It serves as a foundation for the SHIP because it describes the status of health and well-being in our state. The SHIP is more action-oriented and forward-looking and serves as a prioritized plan for the future. We have a 2-page executive summary for the SHIP that's designed for a broad audience, so we encourage you to share it widely with your contacts. Then we have the full SHIP document, which includes menus of priorities and strategies. There's a basic guidance document specifically for local health departments and hospitals because they have their own planning and assessment requirements, and Laura's going to say more about that towards the end of the webinar. There will also be a toolkit with more detailed information about how to implement each aspect of the SHIP, and this toolkit will be posted later in 2020. Finally, we'll be developing some cross-sector partnership materials, starting with a focus on housing and education partners, and these will be posted later in 2020 as well. These materials have different levels of detail that can be useful to you and your community depending on where you are in the assessment and planning process. So we encourage you to check out these resources and see how they can help you align with the SHIP, and we also encourage you to share them with others in your community. These materials will be posted on the Ohio Department of Health SHA-SHIP website, and you can also find them on the HPIO website under the Groups tab for the SHA-SHIP group. Now I'm going to talk about the key concepts in the SHIP, starting with the framework. I want to point out here 3 aspects of the SHIP framework that are somewhat different from the previous SHIP. First, equity is a more prominent component of the SHIP, and it's embedded in every section. Second, this SHIP has a stronger focus on the many factors that shape our health. I'm referring here to the blue box on the left, and the SHIP includes measurable objectives for community conditions, health behaviors, and access to care. The third thing to notice here is that the health outcome priorities, the green box in the middle, these are very similar to the 2017-2019 SHIP. So there is a lot of continuity in terms of health outcomes and strategies between the previous version and the current version of the SHIP. These are the 4 key components of the SHIP. And now I'm going to walk through each of these, starting with equity. Here's the definition of equity we use in the SHIP. Health equity is achieved when all people in the community have access to affordable, inclusive, and quality infrastructure and services that, despite historical and contemporary injustices, allow them to reach their full health potential. And here are the ways that equity is woven into the SHIP. Priority populations are groups of Ohioans with outcomes that are at least 10% worse than outcomes for Ohio overall. Universal targets are the same long-term target for Ohio overall as for priority populations, reflecting the goal of eliminating disparities. For strategy selection, we highlight strategies likely to decrease disparities and inequities. And for strategy implementation, the SHIP document and the toolkit talk about allocating resources and tailoring strategies to communities where need is greatest, and also the importance of cultural competence and cultural humility in the delivery of services and programs. Moving on to priorities, these are listed in the blue and green boxes in the framework. So we'll zoom in on those. These priorities were identified through a multi-step process involving input from hundreds of Ohioans, including, I'm sure, some of you on this webinar today. This included regional forums and online surveys, as well as review of the secondary data in the state health assessment. Moving on to tracking progress. The SHIP has 37 measurable objectives. This allows us to measure our progress over time and hold ourselves accountable for reaching desired outcomes. So this is really about data transparency and shared accountability, which are key aspects of collective impact. Now I'll go through some background on some of the terminology that we use in this section of the SHIP to track progress, starting with SMART objectives, and I'm sure many of you are familiar with these specific, measurable, achievable, realistic, and time-bound objectives. Here's an example of what this looks like in the SHIP. So an objective is a statement describing the specific outcome to be achieved, and it has many different components that are marked out here with the red boxes. So we'll go through some of those. First, looking at the desired outcome. In this example, it's to reduce infant mortality. So this is a general statement about a desired result. This is the specific indicator. Indicators are metrics used to quantify an outcome, typically expressed in a rate or a number or a percent. Then we have the baseline data and targets. So targets are a specific number that quantifies the desired outcome, and the SHIP includes short-term, intermediate, and long-term targets. When we have disaggregated data and there is a notable disparity or inequity, the objectives in the SHIP include this orange row for priority populations, and sometimes there are several priority populations listed. And here's what we mean on the right-hand side by a universal long-term target. So you'll see that even though the baseline data shows a huge disparity gap, the long-term target is the same. This means that the goal is to eliminate the disparity, which will require intensive allocation of resources and tailoring of strategies to meet the needs of the priority population. The last component is strategies. Strategies are policies, programs, or services. And all of the strategies in the SHIP are evidence-informed and focus on primary prevention, secondary prevention, or access to care. Here's the general approach we use to select the strategies included in the SHIP. So we were looking at things like evidence of effectiveness and potential size of impact on the SHIP outcomes, including equity. We consulted evidence reviews and inventories like these to find the most effective strategies that aligned best with our SHIP objectives. Most strategy sections highlight featured strategies, and this is somewhat new for this version of the SHIP. And we did this because we got feedback from stakeholders that it would be helpful to have a bit more guidance on which strategies to pick and to have a more concise list than we had in the previous SHIP. We also heard from many of you that it's important to have a long menu of strategies that works well for all kinds of communities. So to strike a balance, we've provided featured strategies and additional strategies throughout the SHIP. Here are the criteria we use to elevate those featured strategies. So we were really looking for strategies with the strongest evidence of effectiveness. Again, that focus on disparities, continuity with the previous SHIP, and some other factors as well listed here. Also, in response to feedback from the advisory committee, we developed this strategy quick guide that lists all of the featured strategies in one place so you have a concise list. Now I'm going to talk about how the SHIP document is organized. These are the sections of the SHIP, and parts 3 through 4 provide detail on the 3 priority factors, and parts 6 through 8 provide detail on the 3 priority health outcomes. And now I'm going to walk through what those pieces look like. Here's an example of the introduction to a topic. We have a short narrative to give it some context, and then we provide the SMART objectives. And you can see the priority population rows there in orange. This is what a strategy page looks like, and you'll note the featured strategies are listed at the top. And each section includes a summary of Ohio's response contributed by the governor's office. And now we're going to transition back over to Laura to talk about the basic guidance.
Thank you, Amy. So the basic guidance document, one of the things I wanted to show you is the previous guidance document is in blue, and the new one that you've seen several times is now in the green and dark blue banner. This will be used by local health departments and hospitals in their work in coordinating and aligning. One of the reasons why we put this together is to help support the requirements within the Ohio Revised Code and the SHIP alignment expectations for both the hospitals and the local health departments. And so within that, we want to share with you what those alignment components are, or alignment pieces are per SHIP component. So for the priority area, we would like for you to identify at least one priority factor and one priority health outcome, one of each. In terms of the SMART objectives, select at least one indicator for each priority factor and each priority health outcome. You may select more, but at least one indicator. And for strategies, select at least one for each selected priority factor and one health outcome. So one for each. And then in terms of equity, what we would like for you to do is identify at least one priority population and select a strategy that is likely to reduce the disparities and inequities. And then really making sure that the strategy that is selected will meet the specific, unique cultural needs of that population. One of the things that we will talk more about in future work is developing relationships with individuals and agencies that serve those populations so that the work can be most effective and supportive to the individuals and families that you're trying to work with. So in terms of alignment timing, you'll see that there's some original language that was in the Ohio Revised Code working towards October 1st of 2020 and then October 1st of 2021, depending on where the development process was for the local work. But in light of COVID-19, the Ohio Department of Health is looking at the requirements and what content would need to be submitted, as well as the date of submission of materials. We're really trying to consider the feasibility of what's been happening at the local level, the entire statewide response, and what capacity is at the local level right now to meet those needs. So please watch the Ohio Department of Health's website for updates. We will let you know. We are looking to have something posted on that late spring, early summer. You can also contact me to discuss this or email questions. We will also send email notifications on this once a decision has been made. So in terms of next steps, we are really excited about next steps. There will be more tools and support in the coming months and beyond. Please continue to check the Ohio Department of Health's website. We will have information on there for releases, like the one we just mentioned on the alignment information. There will be other releases that come forward. We will have updates on our partners at the local level and the state level. There will be information on innovation, on tracking, results, and multiple tools, some of which Amy highlighted in her presentation. Some of this information will also be available on HPIO's website, so please look to their site as well for information. And to wrap up today, I just want to share the vision and the mission of the State Health Assessment and State Health Improvement Plan. Again, the vision is that Ohio is a model of health, well-being, and economic vitality. And the mission is to improve the health of Ohioans by implementing a strategic set of evidence-based population health activities at the scale needed to measurably improve population health outcomes and achieve health equity. Amy and I would both like to thank you on behalf of the Ohio Department of Health and the Health Policy Institute of Ohio for taking the time to listen to this webinar today. We also thank you for everything that you do on a daily basis to help support and improve the health and well-being of Ohioans. Thank you so much.